Okay, this is the procedure for actually starting an IV. Now, on the IV start, remember we have already prepared our tubing and our bags. We have our bag of fluid ready. And now we're in our patient's room and we are going to start the IV. To start the IV, of course, you're going to wash your hands, you're going to check your patient's ID, you're going to tell them why you're here. Then you're going to get all your supplies ready. Supplies you're going to need is an IV catheter. You need an INT. You need an IV start kit. You need a pair of clean gloves. You need a saline flush. And you might want to have a few extra alcohol preps or ChloraPreps. There is one that does come in the IV start kit, but you might want to always have some extras there. I always also take an extra IV catheter when I go into a patient's room, just to make sure I have everything. Once I have all of my supplies there, then the first thing I usually do is go ahead and prime my INT. On the INT, if you've taken it straight out of the sterile package and you have not touched this, then it's sterile. If you have touched it though, you want to always clean this with alcohol real good. And then you want to get your saline flush ready. Now, one thing I want to point out on these saline flushes, they will always have air in them that you must get out, okay? The easiest way to get the air out is to aspirate back first, and that breaks the seal that's in these syringes, and then push up till you get the air out. Once you have the air out, then you're going to attach your syringe to your INT, and you're going to prime your INT, and it doesn't take very much to prime it. Go ahead and loosen the cap on that INT, because you're going to have to be able to get it off with one hand in just a little bit. Personally, I like to just lay it back in my package, just so it just provides an extra level of security in case the cap falls off. Now that I've done that, I'm going to open up my IV start kit. And in your start kit, oh, this kit has some gloves in it. Your kits do not have gloves. I will go ahead and tell you that. There should be a tourniquet, though. There should be some tape. This is your ChloraPrep. And then this is your Tegaderm, or your Opsite, that we're going to use to cover the sterile dressing. It's a sterile dressing that we use to cover the IV site. Okay? And there is a label, but there's also a label that comes on the Opsite, so you can use either label that you want to. And then there's some gauze that we'll use in just a minute when we DC the IV. Now that I have all of this out, I'm going to go ahead and tear some tape. In the hospital, you're going to tear a lot more tape than what I'm going to tear. The first piece of tape I'm going to tear is about 3 or 4 inches long, and I'm going to tear it in half then, like 2 long skinny pieces, because we're going to use one of these pieces and we're going to pretend it is a stat lock. Stat locks are something that a lot of the hospitals are using to hold the catheter in place. Some of the hospitals have quit using them now, so you will need to check the procedure at whichever facility you are at. But remember, this is not really tape we're putting on there. This is just a cheap man stat lock, because they wanted $5 to add a stat lock to your IV start kit, so we didn't think it was worth that much money when we can just use tape. I'm also going to tear some more tape. When you're practicing, there's not much tape on these rolls, so just tear the least amount that you can get by with just to hold your catheter in place. Once I have all of my supplies in place, then I'm going to go ahead and put the tourniquet on, and I am going to look for a vein. Remember, you always want to look distally first to try to find a vein, because if it infiltrates up here, then you could not go down below that area to restart the IV. So if you can find a distal vein, then that's best. Usually put the tourniquet about 5 to 6 inches above where you're going to stick. When you tie the tourniquet, you do not tie it in a knot. You want to make like a half bow. So you have to pull it really tight and then take a little loop and stick under there. If it's not really tight on the arm, then it's not tight enough. This is something you're probably going to have to practice on at home, tying the tourniquet, because you have to be able to pull it and pop it off right away. Okay, so I'm going to retie it so you can see again how to tie a tourniquet. And then I look for a vein. You want to find a vein that's straight, that doesn't have any sores or open wounds or anything. This patient has a huge open wound right there, so I would not want to stick right there. Okay? And when you feel the vein, it should feel spongy. If it feels real hard when you feel of it, don't stick that vein because it's sclerosed and it's not going to work. Okay? If you don't have all your supplies ready, then you would automatically take the tourniquet back off and then get everything ready. But if you have all your supplies ready, then you can go ahead and clean. This is the little CoraPrep. That's sterile at the end, so you don't touch that. To break it, you squeeze and it breaks. Okay, and you have to squeeze pretty hard. And then you want to squeeze your fluid down. You want to clean in a circular motion from inside out. And you want to get it good and saturated because you want it to be good and clean. And you want to clean an area about 3 to 4 inches in diameter. Okay? Once you've gotten that done, this personally is when I put my gloves on because that has to dry before you stick. If you want to put your gloves on before that because you're afraid you're going to forget it, then that's fine. That's up to you. Once I have my gloves on, remember these are just clean gloves, so I cannot turn around and touch the site where I'm actually going to stick, because if I do, then it's contaminated. Next, I'm going to open my IV catheter, and this is like the catheters that they use in the hospital. You take this off, and you want to inspect your catheter and make sure that it's intact. You also want to twist so you can break the seal on that catheter. Do not pull it up off of there and put it back on, because little pieces of the catheter can shear off and then it can go in the patient's vein and cause a thrombus. Okay? Do not touch that white button that's on there, because that white button is what will retract the needle when we're ready to take the needle out of the catheter. Okay, so my catheter is ready. When you hold it, you don't hold it like a pencil. You hold it from on top, just like this, and there's some little ridges that are built in just for your fingers. Once you're ready to stick, you want to anchor your vein. Now you can anchor below where you're going to stick, but if you do, make sure that you anchor well below where you stick, because you cannot touch any of the white part of the catheter, because that's what's going into the patient's vein and must remain sterile. If you're afraid you're going to contaminate, then you can anchor up above the vein. But remember, you cannot retouch where you have cleaned. If you do, then you have to clean again before you stick your patient. Okay, so I'm going to anchor, and when you're down low in the hand like this, you can kind of pull their fingers down, and that will anchor the vein. Now that I have my vein anchored, I want to go in at about a 30 to 45 degree angle, and I don't have my glasses on. So you want to pierce the skin. Once you pierce the skin, decrease your angle. And then you're going to advance the catheter till you get a flashback of blood in the chamber. Once you get your flashback of blood, go in about another 1/8 of an inch, and then you're ready to slide your catheter off. That's what's called threading the catheter. These catheters have a little notch on there that you can push it in with. If you have the type of catheter that does not have the notch, you can let go of your anchor, and then you can use a couple of fingers to slide your catheter in. So once you get your catheter threaded, it should look something like this. Do not push the needle in with the catheter, because if you do, you're going to go all the way through the vein. Once you have it in, then you are ready to anchor. And I usually hold a finger here and a finger here, but however you want to do it is up to you. Pop your tourniquet. Pick up your I&T. And remember I said we needed to get that cap off with one hand. Then we want to push this button to retract our needle. And this is when you want to attach your catheter. And that has to screw on tightly. Once you have that done, I always just go ahead and aspirate to make sure I'm still in the vein, and then flush a cc or two just to make sure it's going to work. Once I see that it is working, then this is when I want to put My stat lock, remember this is not really tape, this is a stat lock that I'm putting on. The stat lock only goes on the hub of the catheter. You cannot put the stat lock over your insertion site, and you cannot put it where the catheter and the tubing connect, because if you do, then you're not going to be able to get this tubing off later if you need to. Once you've got that on, then you're ready to put your op site. Now this op site is sterile under there, and it's real sticky, so do not touch that. This goes where the little window is over your insertion site, so you can see if there's any problems with phlebitis or anything. Once you get that on, you take the paper off. Okay. You'll notice we have our little label that we would fill out with the date, the size catheter, and your initials, and usually put it on the side over here somewhere. And then I usually would go ahead and finish flushing. And then this is when you would curl your tubing up and put more tape on. Now personally, I like to put a piece of tape right across here because it holds this loop of the tubing. If you don't put a piece of tape across here and this is kind of hanging, your patient can catch that on something and pull their IV out. If they move around a lot, you're probably going to want to put more pieces of tape on. Okay? Once you get your tape on, if you're not going to connect it to fluids, you would slide your clamp closed. If you were going to connect it to your IV fluid, you would clean, and then you would take your tubing, take the cap off, and then you would attach your tubing and screw that on, and then you would turn your pump on. Okay? Once you have your IV catheter going, you need to check your IV site a minimum of every 2 hours, and you're looking for infiltration and phlebitis. Now, infiltration is going to be edematous or swollen. It's going to be cool to the touch. Phlebitis is going to be red, it's going to be warm, and it's going to be very tender. So these are the things that you're really watching for once you get your IV started. Next, we're going to do the procedure for DCing an IV. So we just found out our patient is going to go home. So now we're going to DC their IV. To DC their IV, you would turn your fluids off. And I usually go ahead and just disconnect it. We're going to throw all that away. Then all this tape that you've just put on, you're going to remove your tape. Remove your op site. And your stat lock. Once you have all of that removed, you need to get your gauze, and you want to fold your gauze into a small square like this. So fold it in half and then fold it in half again so it makes a little square, and this creates a pressure dressing. Lay that over your insertion site and slide your catheter out, and then you want to hold pressure on this site for a minute or until the bleeding stops. If your patient is on heparin or Coumadin, you may have to hold it 5 or 10 minutes. You want to inspect your catheter to make sure that it is intact, and then this would go in the sharps container. Once you have verified that the bleeding has stopped, either put a Band-Aid over the site, or you can take some tape and put over your pressure dressing. And then now our IV has been discontinued. Remember, on IV start, the main things are you cannot contaminate, you must wear gloves, and know what has to be kept sterile. Because once you clean your IV site, you can't stick a different place than you clean. That's happened in the past. We have students every semester that retouch after they've cleaned it. And then when you're sliding your catheter in, remember your fingers cannot go inside anything of the catheter. And you also cannot touch any of the white part of the catheter because that is contaminated. When you put your stat lock on, remember the stat lock only goes across the hub of the catheter. It cannot touch your insertion site, and it does not go up above the end of the hub where it connects to your INT. All right, good luck to y'all.